Hi, my name is Carla Ponton. And my topic is hip strength and the core endurance in female adolescent runner with Witherspoon and without knee pain. Definition: the hip is one of the most mobile joints in the human body and is responsible for the stability of the entire trunk and the mobility of the lower extremities. The core is the lumbopelvic hip combination, commonly known as the central region. Is the region that provides our body with stability for the movement. Physical therapy application. Physical therapy sessions help to prevent injuries, seeking improvement in flexibility, power in the core and muscle, and soft tissue imbalance. Performing muscular unloading periodical prepares the system before the race, prevent injuries and improve both the time in the resist of the runner. Pros and cons. Pros: among the most beneficial aspects of core strengthening are improved stability and balance when running. Exercise program aimed at strengthening the core and becoming more and more widespread among athletes. Cons: imbalances in the area can have consequences in our body, such as increased fatigue, decreasing endurance of different types of injured runner.
2 minutes. So the core muscles play an important role because they help stabilize the spine when it moves. So what I've got here is a vertebrae. I've got the body of the vertebrae, transverse processes, spinous processes. And so the first muscle of the core that I want to talk about is that of the psoas major. Now the psoas major sits around about here. You can see we've got a bird's eye view of the vertebrae. There's the psoas major. Its important role is that it connects the upper and the lower body together. So it actually connects to the femur, which means it's a hip flexor. So when you contract both, you can go into a sit-up position if the legs are locked in. If you contract one psoas, then you're going to have this unilateral contraction and you bend the trunk in one direction. Another muscle is going to be the QL. This is the deepest muscle of the abdomen, the QL, quadratus lumborum. And very similar to the psoas, contract one, you get this unilateral flexion, you flex the spine in one direction, bilateral flexion, and you have like a sit-up position. Now, another very powerful muscle at the back is going to be this large muscle here. And this is the erector spina muscle, and it is very powerful when it comes to back extension. Another muscle, which is a synergistic muscle when we look at the core, is that of the latissimus dorsi, so the lats. And the lats are important as a synergistic muscle, so they work with other muscles when it comes to lateral flexion and extension as well. Let's not forget the abdominal muscles, and the ones I want to talk about, 3 important abdominal muscles here. So let's separate it. 3 is going to be, starting from the outside, is the external, internal, and transversus. And they're important when it comes to breathing, but also moving the trunk, and they help prevent hyperextension. Now, we've only got the sides and the back here. We've got a muscle at the top called the diaphragm, and the muscles underneath, which are the pelvic floor muscles, all form a corset holding the core tight.
Girls. Conclusion: the hips and muscle around the pelvis are the basis for many movements. Adequate hip strength and flexibility in the appropriate muscle are the keys to proper range of motion. Stability and injuries always present in running, and you can avoid doing a correct warm-up. and going to especially when the runner present and it is conformed.
The end of the thigh bone. This is a joint that can give people a lot of problems, and there's a lot of ailments that can affect this joint. The thing to understand about this is a very high stress joint. The cartilage coating in this joint is some of the thickest cartilage of any joint in the body. And the reason for that is that this joint has some of the highest stress on it of any joint in the body. The quadriceps muscles, the muscles in the front of the thigh attached to your quadriceps tendon that goes through your patella or your kneecap and then attaches down onto the shin bone down in through here. Those are very strong, powerful muscles that exert a lot of force on this area. One thing that can happen is those muscles can get very tight over time. And what that does is it puts tension in the tendons, making them more irritable, but also creates a situation where you're essentially taking that patellofemoral joint and tightening it. The kneecap gets bound down in that groove, and that can cause a lot of pain. Some of what we're trying to accomplish with therapy is to help loosen that up, both the muscle attachments, loosen up the muscle that reduces tension on the tendons, and then also loosen up the ligamentous attachments around the kneecap that can get bound down as well. A second thing that can occur is that people can actually have looseness around the patella. The ligaments that stabilize it can be somewhat loose and lax, particularly if someone has generalized loose jointedness. And this can cause extra motion in that kneecap joint that can also cause irritation. The goal of the strengthening exercises is to help strengthen them and stabilize this kneecap somewhat and help some of the irritation that comes from that extra motion go away.
Thank you.